Are INFP traits the symptoms of ADHD? INFPs and ADHD are separate concepts that describe different aspects of an individual. It's worth mentioning that some individuals with ADHD may exhibit traits commonly associated with INFPs, such as being introspective or having a strong sense of idealism. However, it's essential to consult with a qualified professional to diagnose ADHD or to understand one's personality type accurately. Let's take a closer look at each. The traits associated with being an INFP, introverted, intuitive feeling, perceiving, are not the same as the clinical manifestations of Attention Deficit Hyperactivity Disorder, ADHD. INFP is a psychological framework categorizing and describing different personality preferences. INFPs are known for being introspective, imaginative, empathetic, and preferring flexibility and spontaneity. They tend to be sensitive, value personal values and authenticity, and often have a strong sense of idealism. ADHD, on the other hand, is a neurodevelopmental disorder that's noticed by a persistent pattern of inattention, hyperactivity, and impulsivity that can significantly affect an individual's functioning in daily life. Some common symptoms of ADHD include difficulty sustaining attention, being easily distracted, impulsivity, restlessness, and difficulty organizing and prioritizing tasks. While the INFP personality type and ADHD are distinctive concepts, there may be some superficial similarities or overlaps in certain traits or behaviors that both possess. It's important to remember that these similarities don't mean that one causes the other, as they are separate phenomena. Here are a few potential areas where both concepts overlap. One, daydreaming and the inner world. Both INFPs and individuals with ADHD may tend to daydream or have a rich inner world. INFPs use daydreaming to escape the harsh situation of the outside world and create a perfect world for themselves. However, in the case of ADHD, excessive daydreaming may be more related to difficulties with attention and focus. 2. Sensitivity and emotional intensity. INFPs are known to be super sensitive to things and have profound emotional experiences. This is also the same with individuals with ADHD. They may exhibit heightened emotional reactivity or intensity like INFPs. However, it's important to note that emotional sensitivity alone does not indicate ADHD, so it would be wrong to conclude that both traits are identical. 3. Procrastination and difficulty with organizing. INFPs and individuals with ADHD may struggle with procrastination and maintaining organized routines. Sometimes INFPs can be lazy if they don't find the motivation to do something, and this could make them procrastinate. When stressed, they could also struggle with organizing things because they're overwhelmed. But they can always get back on track when they have to. However, in the case of ADHD, procrastination and poor organization are often more pronounced and pervasive because they lack focus and it affects multiple areas of their life. 4. Hyperfocus. This trait is often associated with ADHD, but can also be observed in some INFPs. Hyperfocus refers to intense concentration and absorption in a particular task or topic, often to the point of losing track of time or surroundings. For ADHD, it may occur as a result of the disease condition. For INFPs, it occurs when they're motivated or intrigued about something. They would give it their utmost best. While some traits may overlap, it's essential to recognize that INFP traits are related to personality preferences. In contrast, ADHD symptoms are associated with a neurodevelopmental disorder. They are distinct concepts and shouldn't be conflated. It's always best to consult with a qualified mental health professional for a proper diagnosis or understanding of these conditions. Having ADHD does not automatically make someone an INFP, and being an INFP does not mean someone has ADHD.